Okay, so today I am going to be doing a video on how to do a full mouth survey of the 18 images that we usually do in the mouth whenever the patient comes in to get radiographs for their teeth. So what we're first going to be doing is we're going to be doing the maxillary arch. That's what we always start with. So whenever we do the maxillary, I'm going to be starting with my molars first. And whenever I start with my molars, I'm wanting to get them the sensors centered with the second molar. And whenever we're doing this, we're going to be trying to get the first, second, and third molar, and if they are all still existing in the mouth. Some people don't have their third molar, their wisdom teeth, so that then we would just center it. Okay, so we're going to be centering it in the mouth, having the patient bite down, and then here's my sensor, and then here's my cord, and then here's my PID ring. So I'm going to be centering it into the patient's mouth. We're going to be biting down. We're going to want to line this up with the corner of the eye and the mid cheek area. And I'm going to be taking my camera here and lining it up with my PID ring, and we're going to be taking the image. Once we're done, we're going to be putting it back, telling the patient they're doing a great job, and then I'm going to be having them do the premolar shot, and we're going to want to center the premolar shot on the second premolar, because we're going to want to be getting distal of the canine in the first and the second premolar in the mouth. So once I get that in there, I'm just going to be telling them that we're going to actually center it with the pupil this time instead of the corner of the eye and still the cheek. So I'm going to be lining up my PID right here, and I'm just going to be taking the shot and telling my patient that they're doing still a great job. And now we're going to be moving on to the canines and the lateral incisors. So for this shot, it can be kind of tricky because everybody has a different arch, and people's mouths are shaped different and all of that. So we're going to want to center it with the contact point right in the lateral of the canine. And this we're going to be centering it with the center of the nose, and we're going to be wanting to get the canine and the incisor. So here we go. We're going to be telling the patient they're doing a great job, taking a picture. Once the picture is taken, we're going to be taking it out of the patient's mouth, and then we are just going to be moving on to the central incisors. Now, the central incisors are one of the more tricky ones in my opinion, and we're just going to be centering it with the central incisor, and then we're wanting to be getting the mesial and distal of the apices, and then I'm just going to be centering it with the tip of the nose. So, and then we're going to be centering our camera. So here we go. 1, 2, 3. Good job. Tell the patient good job. We're just going to be moving on to the other side of the mouth. And I'm going to be doing my molar again. So we're going to be flipping it around in our sensor. We'll be doing the other side of the maxillary. So we're going to be lining it up with the second molar again. We'll be lining it up with the corner of the eye and the mid cheek, telling the patient they're doing a great job, taking the photo. We want to make this as timeless as possible, just because this can be very uncomfortable for the patient. So then we're going to be moving on to the premolar shot. We're going to be lining it up with the second premolar, and we're going to be lining it up with the pupil of the eye and the midline, the cheek. We're going to be lining it up and taking the shot, telling the patient that they're doing a great job. Moving on to the lateral incisors, we're going to be doing this with the contact point of the canine and the lateral, and then we're going to be lining this up with the center of the nose, and we're wanting to be getting that apex of the canine for this one. So we're going to be lining it up, telling the patient that they're doing a great job, take it out of the mouth, and then we're going to be doing the central incisors. So this one can be kind of a mouthful because you have to get it like lined up with the tip of the nose, and I'm going to be positioning right up here, and then I'm going to be taking the photo, telling the patient they're doing a great job, and we're almost halfway there. And I'm going to be moving down now into the mandibular arch because that's what we do after the maxillary arch. So basically we're just going to be doing the same thing all over again. And we want to go from one side of the arch, maxillary, and then we just rotate to the bottom, the same side. We just go from like upper left, upper right, and then lower right to lower left. So it's basically just one big circle. I'll be positioning this in here. I'm going to be doing my lower molar shot, and then I'm going to be positioning it and centering it with the second molar, and then I'm going to be lining it up again. This will be from the outer canthus to the mandibular area. We're going to be pointing it down, and we're still going to be wanting to get all the first, second, and third molars. So after we get that, we're just going to move on to the premolar shot. I'm going to line it up and center it with the second molar. Second premolar, sorry, since it's obviously a premolar shot. And then I'm going to be doing this from the pupil to the mid-mandibular area. And we're just going to be getting the distal of the canine in the first and second premolar, and then probably the back, the mesial of the first molar. So I'm going to be positioning it downwards, and then I'm going to be taking the photo. Okay, now we're going to be moving on to the canine lateral, and just like the maxillary arch, we're going to be wanting to kind of angle it just because everybody's mouth is shaped just a little bit differently. And we're going to be doing the distal of the lateral incisor and then the mesial of the canine. And then we're going to be doing the corner of the nose to the chin corner for this shot, angling. So here we are, angling it down, getting that good shot. And then we're going to be moving on to the central incisors. In this one, we're going to still point down from the tip of the nose, but we're going to point down from the chin, so it's more like this instead of like this. And once we do that, we're going to line it up, and we're positioned downward now, more downward, so it's like this. And we're going to be taking it, and then this one is, we're just going to be getting the mesial and distal of the central incisors. So now we're going to be moving on to the other side, doing the same thing. Getting our molar shots first, lining it up with the second molar, getting that good shot, moving on to the premolar, lining it up with the second premolar, getting a good shot, telling the patient that they're doing a good job, lining up with our lateral incisors and canines, and then we're going to be taking the shot. And then lastly, we're doing the central incisors on this side. Okay, and then the last thing that we have to do in the mouth are the bite wings. So we're going to be doing the molar and the premolar on both sides. These ones can be easier for patients, most likely. So we're just going to be placing it in here. And we usually do the premolar shot first for bite wing. So I'm going to be lining it up with the second premolar again, just to be sure that we get both premolars and the mesial of the first molar, and then the distal of the canine. So I'm going to be placing it downward from the outer corner of the eye, the pupil of the eye, and I'm going to be facing it downward. And then we're going to move to the molar on the same side. We're going to be lining it up with the second molar and the second premolar. And then we're going to be pointing down from the corner of the eye, in the occlusal plane. So once we do that, and we get it, we want it like pointed kind of downwards like this, just so that we can get the roots of the tooth. And yeah, so then I'm going to be doing it on the same side over here. Same thing on this side. I'm going to flip my sensor. Okay, and then we're going to be doing it at this. We're going to be lining up for our premolar, and we're going to be doing it in the canine. We're going to be lining it up with the canine. I mean, centering it in the canine, because we want our 2 premolars. We want the distal of the canine and the mesial of the first molar. So we're going to be positioning it downwards from the pupil of the eye to the occlusal plane. So once we've got that image, the last image that we need to be taking is the molar image. So for the molar image, we're just going to be doing it at the anterior edge of the second premolar. So we're going to be facing it downwards from the outer corner of the eye to the occlusal plane. So we're going to be we want to get the roots and we want to get the crown. We want to get the crown, but we want to get as much root as we can. So I hope that this was a good explanation of how we would perform a full survey of radiographs on a patient whenever we do the full 18 series. So, yep.